From the production line to the arm, a vaccination programme of historic and logistical might. Yesterday, the UK became the first to give temporary approval for the Pfizer BioNTech vaccine. Today, it's believed to have arrived on these shores via the Eurotunnel. Now begins the really hard work. Even the army is on standby.
There is a sense, as I said, that this will be difficult. But hey, this is what we're good at in the NHS. As we proved with those 33,000 beds in the first phase of COVID, we're good at meeting complex logistical challenges. But this is going to be hard. There's no doubt about it.
The priority list puts elderly people in care homes and their carers first for the jab, followed by those aged 80 and over and frontline healthcare workers. But the logistics means in reality it won't happen quite like this. Across England, 50 hospital hubs have been set up. If a care home resident or care staff can get to the hub, they will be vaccinated. We were told taking the vaccine to a care home itself is proving more difficult.
The first vaccine comes in these deep frozen minimum batch sizes of 975, and it isn't deep frozen all the way. You then can thaw it, and it's stable at 2 to 8 degrees for 5 days.
What's more, breaking down those large pack sizes has not yet been authorised by the medicine regulator, although the Scottish Government today disputed this and said they could split up the batches and supply care homes without wastage. All a sign that none of this is going to be easy. And even having the jabs does not mean immediate protection. The Pfizer-BioNTech vaccine requires 2 full doses. If the first vaccinations take place next week, the earliest the second dose of vaccine could be administered would be from the week starting the 28th of December. Immunity takes another 7 days to kick in. Therefore, those getting the vaccine first will only have protection after Christmas, possibly from the week beginning the 4th of January. Government ministers' pride in becoming a world first is, however, jarring with other countries. This was the Education Secretary this morning.
Well, I just reckon we've got the very best people in this country, and we've obviously got the best medical regulators, much better than the French have, much better than the Belgians have, much better than the Americans have. That doesn't surprise me at all, because we're a much better country than every single one.
The European Commission response was, this is not a football competition. In America, Dr. Anthony Fauci, one of the country's leading and most high-profile coronavirus experts, also queried the speed with which the vaccine was given UK authorization.
We have the gold standard of a regulatory approach with the FDA. The UK did not do it as carefully. They got a couple of days ahead.
The medicine regulator reiterated that no corners had been cut, that authorization was rigorous and without compromise. All of this, though, is underlined by the news today, that the number of COVID-19 deaths in the UK passed the 60,000 mark.
Victoria MacDonald. And Scotland's Health Secretary, Jean Freeman, has also been talking today about Scotland's vaccine plans. Our correspondent, Kieran Jenkins, is in Glasgow. Kieran.
Well, you heard there in Victoria's report that key obstacle to getting this vaccine into care homes is being able to break up those giant batches of 975 vials that are stored at -70, and that senior figures in England have suggested that further approval is needed from the regulator to safely be able to do that. However, in Scotland today, an announcement that the Scottish Government believes the batches of the vaccine can be safely split up and delivered in smaller consignments to care homes. So Scotland is the first part of the UK that's setting a date for care homes. Next week they'll vaccinate the vaccinators, and on December the 14th they hope to have this vaccine in or near care homes. Here's the Scottish Health Secretary, Jean Freeman.
I'm also pleased to confirm that under certain conditions we can pack down to smaller pack sizes, both of which makes this vaccine more usable with minimum wastage for care home residents and for our older citizens. So in effect, we can take the vaccine to them or close to them, and we will begin that exercise from the 14th of December.
So how come you have parts of the UK that seem to think further approval is needed from the regulator to get this vaccine into care homes, but in Scotland, same regulator, and yet the government here believes it has the green light. Well, when we asked the regulator, they pointed us to a document published yesterday that sets out the strict conditions for this vaccine, including around transportation and packing down batches for distribution. They did not directly answer our questions, however, about the Scottish Government plan. All the same, there's been a terrible number of deaths in Scottish care homes from coronavirus, and they will be simply delighted that a date has been set to get this vaccine to them. Elsewhere in the UK, it's been devastating as well for care homes, and people are already asking there if it can be done in Scotland, why not elsewhere too?
Kieran Jenkins.
Now, the UK government has begun rolling out rapid testing for care home visitors in England so that people will finally be able to see their loved ones as often as twice a week before Christmas. There's already disappointment that care home residents won't now be top of the list to get COVID vaccines because of the logistical challenges. But we've been to one home in Liverpool to see how they're coping, and the family who were hoping to be reunited after many months apart. Our North of England correspondent Claire Fallon has this report.
In a week of firsts, the UK, the first place in the world to approve the first COVID vaccine. At Abbeydale Nursing Home, there was another first.
So obviously when you go in
Flintoff has just passed his third COVID test in 24 hours. His grandfather is 92 and has dementia. They've not seen each other since the summer, under a gazebo in the care home's garden.
How long do you reckon it's been?
At least been 2.5 months, I'd say. And we shall be coming there every day, really.
There you go, I'll let you. Who's that? It is.
Even with testing and PPE, to cut the risks to those who live here, kisses can only be blown. With COVID and care homes, it's never simple. It was meant to be Flintoff's mother here today. Instead, she's on a screen. One of her COVID tests was a void. She needed 3 negatives. She found out this morning, a couple of hours before she was due to see her dad.
Wave, there you go, give a wave.
It's loads of families, really, that have experienced what I've experienced, not being able to see them. So I just feel like, hopefully with this vaccine, like especially in care homes, obviously the number of cases can start declining a bit.
The vaccine is another example where things are not simple when it comes to COVID and care homes. The logistics of storage, temperatures and batch size, prompting a warning that although those living and working in care homes for the elderly are top of the priority list, they may not get the vaccine first.
The big message yesterday was the vaccine's available, care home residents are number 1 on the priority list. So if you're living within a home or you have a relative or a loved one within a home, that's your expectation. You're asking people to be patient who have been the most impacted by COVID-19, have suffered in the most very difficult circumstances and hugely impacted by it. To be told to be patient does feel a little bit insulting.
The government says operational challenges mean flexibility will be needed when the UK's biggest ever vaccine begins next week. And there are challenges around messaging too. Even here, where they know the risks better than most, the manager of this care home told me some of her staff have concerns.
I think in our job roles, I think we forget about ourselves. If we personally had a choice, we'd look at all the options, how long's it being tested, what's the results from that. In our job role, it becomes where we think we've got a duty of care to protect the residents. So obviously if we get the vaccine, then we've got to protect them. So there's mixed emotions on the vaccine.
So even people who work in care homes, who've dealt with everything that you've dealt with, there's nervousness.
Yeah, 100% nervousness.
For now, though, this is progress. And with more testing, more families are spending more time together. It's still far from ideal, but it's better than it's been for many for a long while.
Claire Fallon reporting. Well, now, we did ask to speak to the government and Public Health England, but no one was available. We are joined now by Sir Mark Walpole, former Chief Scientific Advisor and now a member of SAGE. Sir Mark, the international community has been raising some eyebrows about the speed with which this particular vaccine has been approved. You've got Anthony Fauci, the Director of Infectious Diseases in America, saying, "We will do a much more thorough job," quote.
Yes, well, I mean, I'm afraid this has become terribly surrounded by rhetoric, and it really isn't a sort of international competition. The MHRA is a very, very good regulator of drugs, devices, of vaccines, and will have looked at this extremely carefully. It is an independent regulator, and it takes its work very, very seriously indeed. And I suspect we're probably talking about a difference of a few days between regulators, but it really doesn't help anyone if people express this as some kind of competition. And it's not surprising when people respond slightly aggressively when people are sort of saying, oh, we're the best. It's not a helpful approach, I don't think.
One hardly needs to say we're in uncharted waters. Is there a danger that as the vaccine becomes more available, discipline will begin to erode?
Well, that is a danger, and people are very miserable about having sort of the social distancing and all the effects. And of course, the piece you've just shown on care homes illustrates the sort of dreadful dilemma, which is, on the one hand, people in care homes are the most susceptible to the most severe death consequences, death from the disease, and indeed, over 20,000 people in the first wave of the pandemic were people in care homes who died. But on the other hand, it's equally devastating for people in care homes not to have access to visitors from their loved ones. Being lonely is terrible if you're elderly, and if you're demented as well, it really is extremely difficult and very disorientating. So it's that very fine balance all the time. But now, with the vaccine on the horizon, is not the time to let up on the social distancing when it's possible to keep the number of deaths down.
But we're also living in a time of tiers 1, 2 and 3. And one wonders how long people will put up with that, given they're going to believe that things are getting safer.
Well, but I'm afraid that's where clear communication is really, really important. And, the temptation is always the measures that have been in place, the tier 3 measures, the month's lockdown, and now the current measures are bringing the numbers down. And so this reproduction number that everyone talks about is now below 1 in most parts of the United Kingdom. The numbers are coming down. The deaths, of course, are still very high because they lag several weeks behind the cases. So people are dying 2 to 4 weeks after they've become infected. And so those numbers are still high, and the average number of deaths is about 450 a day, something around there, which is very considerable. But inevitably, the temptation is when the cases start to come down, people say, aha, it's all right, we can relax. The problem is, if you relax, the virus takes off, and it is still very widely distributed. And it's the vaccine's natural tendency is that there is 100 people on average infect about 300 people. So we need to keep to the measures.
Briefly, Sir Mark, we're suddenly in a kind of cascade of progress, it seems. And I'm just wondering, inside SAGE, where you work, are you feeling perfectly tranquil about what's going on?
It's been impossible to be tranquil at any stage of this. So tranquility isn't the right emotion, I don't think. But I think that, for the first time, there is light at the end of that proverbial tunnel. I think that everyone was delighted that the vaccines really exceed wildest expectations in terms of what we know so far about their protectiveness, particularly what we know about the Pfizer, BioNTech and the Moderna vaccines. And we're waiting for the full results on the AZ, Oxford vaccine and other vaccines. But the protection of more than 90% is tremendous. But we still don't know a number of things. So we know it stops disease. Do we know it stops asymptomatic infection? We don't quite know that yet. What we do know, though, is that vaccines are very, very safe. And it's really important that there's clear communication and that there is some sort of anti-vax nonsense that's out there that we've got to be careful about. It's not that there aren't short-term side effects.
Sir Mark Walpole.
Sorry.
Sir Mark, thank you very much indeed for joining us. Thank you.
Thank you.